Um, Botox injections have become very popular recently, and Botox and the other, botulinum toxin products like Dysport, they work really well. I use them extensively in my practice. It needs to be injected by someone who knows what they're doing. It has to be either a doctor or a nurse or a physician assistant under a doctor's guidance, but someone who's been trained to do it. Because even though it seems like a very simple procedure, it's a very easy procedure to mess up. And there are multiple ways you can mess up. One is by injecting it in the wrong place. Two is by injecting the wrong amount and causing, all sorts of problems, either such as the lower eyelid drooping down, the brow totally dropping down, getting Botox into the upper eyelid so that their eyelid drops and they can't open their eye. Those are just a few of the problems. And then, of course, there's the whole issue of where is the Botox supply coming from? Right now, Botox Cosmetic, there's only one company in the United States that manufactures Botox Cosmetic, and they only sell to doctor's offices. If you're going to your hairstylist for Botox, you are opening up a can of worms that could lead to serious potential problems. And you really need to be having injections, if you're having them, by someone who is experienced and knows what they're doing. The advantage of having a plastic surgeon doing your Botox is that, even though I am the mommy makeover guy, I do a lot of facial surgery as well. I know where the muscles are. I know where they are because I've studied them for years. I operate on them. I operate on the face. I operate on the nose. I operate on the ears. I operate on the eyelids. I know where everything is, and I know very well how to manipulate them, where exactly to place the Botox, and should a complication arise, the plastic surgeon knows how to fix it. So particularly with injectables such as hyaluronic acid fillers, there are a lot of complications that can occur if they're injected in the wrong place. I've seen examples at meetings of patients who had fillers injected into an artery, and a portion of their face, it embolizes into the artery, a portion of the face dies off, whether it's the nose or the cheek. I've seen examples at meetings of patients who were blinded by filler being injected into an artery that goes back into their retina. So these are real problems that happen in this country, and invariably, when it happens, it's by someone who was not properly trained to do it.